The following video progression demonstrates the use of a blood pressure cuff in observing core activation, or rather engagement of the core musculature, sometimes referred to as a draw-in maneuver. As discussed with your clinician, the draw-in maneuver should engage the needle of the blood pressure cuff with a 10 to 20 millimeter rise. The first advancement of this drill requires the engagement of the musculature, followed by a simple march of one leg. During this task, one should seek to obtain no more than a 10 millimeter change of the needle while lifting the leg. The second advancement of the draw-in maneuver requires activation of the core, as seen in the needle here, followed by a step, a lengthening of the leg, and then a slow controlled lowering of the leg, as witnessed in the video here. Again, one should seek to obtain no more than a 10 millimeter change in either a positive or negative direction while performing this task. The next progression of the drill requires the opposite leg to be lifted to 90 degrees. While placing the hand up against the thigh, you'll want to pull the thigh into this hand. Engage the musculature of the core while stepping with the opposing leg, again observing for any move of the needle greater or less than 10 millimeters. Further advancing this drill, repeat the process on the opposing limb, pulling the thigh into the hand. Engage the musculature of the core, followed by a step, lengthen, and controlled lowering of the leg. Once again, observing for any change greater or less than 10 millimeters on your blood pressure cuff. Again, advancing this drill, lift the opposing leg to 90 degrees without pulling into the arm on that side. Engage the musculature of the core and then return to stepping with the opposing leg. Once successful with this aspect of the drill, advance to the next phase, which requires the opposing leg flexed to 90, contraction of the core musculature, followed by a step, lengthen, and controlled lower of the leg. Repeat this process as tolerant or until your needle rises or falls greater than 10 millimeters. The next advancement of our lumbar stabilization drill requires contraction of the core musculature, followed by a march of both legs simultaneously. Once again, looking for any change greater or less than 10 millimeters on your dial. A final and most challenging aspect of this drill requires engagement of the core, a step, a lengthen, and lower of both legs simultaneously. During this progression of drills, your clinician can help advise what is most beneficial and the appropriate stage progression for your absolute needs.